of the total disease burden. They are among the greatest causes of death and disability worldwide. Let's take a look at a few examples to see how nutrition fits in. Starting with heart disease. Heart disease, of course, gets a lot of attention, and there's no doubt that nutrition can play a major role. In fact, of all the diseases affected by nutrition, the data on heart disease, I think, is the most compelling. More than 80% of all cardiovascular events may be preventable with the right combination of diet and lifestyle factors. Pioneering studies by Dr. Dean Ornish, Dr. Caldwell Esselstyn Jr., and others have shown that a low-fat, plant-based diet can prevent, delay, and in some cases reverse the progression of atherosclerosis with subsequent reduction in cardiovascular events. And how about cancer? All the way back in 1980, a major report suggested that anywhere from 10 to 70% of cancer could be attributed to nutritional factors. Just think about those numbers for a second. If nutrition could prevent a percentage of cancers at the higher end of this range, it would revolutionize our health. And now we have data that this isn't just about prevention. For example, there's been very exciting research on treating early-stage prostate cancer with nutrition. The deaths from chronic lower respiratory disease are mostly comprised of chronic obstructive pulmonary disease, or what we commonly call COPD. The big story here, of course, is the risk attributed to smoking, but many do not know that nutritional factors may also influence lung function. A summary report from the American Thoracic Society highlights research showing that a variety of antioxidants, chemicals in plant-based foods, are linked to better lung function. Let's discuss stroke, ischemic stroke and hemorrhagic stroke. Ischemic is related to a clot, while hemorrhagic is related to bleeding. In epidemiologic studies, nutritional factors are associated with reducing the risk of having a stroke, particularly ischemic stroke. And importantly, we know that nutrition reduces the major risk factors for having a stroke, including high blood pressure. Now, several longitudinal studies have looked at the association between lifestyle and Alzheimer's disease. They've shown that those who embrace physical activity, which of course is very important, and a diet richer in plant-based foods can significantly lower the risk of getting Alzheimer's, anywhere from 40 to 60%. So our brains clearly benefit from good nutrition as well. Diabetes is an interesting one. It's very expensive to treat with the conventional medical model, and outcomes can be devastating, including blindness, amputations, kidney failure, and cardiovascular disease. However, research has shown that nutrition can have really a very profound effect on diabetes, especially in cases of early to moderate type 2 diabetes. There's now even some evidence that shows nutrition may have a positive effect on the management of type 1 diabetes as well. Although the link to flu and pneumonia has not been studied extensively, good nutrition can certainly strengthen the body's general immune response, and also it can help prevent the comorbidities that might worsen the effects of these types of infections. Most people don't realize that protein intake and kidney disease have been linked for more than a century. In fact, protein intake and kidney disease is one of the oldest known nutrition links in clinical medicine. The most recent evidence suggests that plant-based diets are good for the kidney, and incorporating more whole plant-based foods reduce risk factors associated with kidney disease, including blood pressure, weight, and other health outcome measures. Of course, the degree to which nutrition affects each of these causes of death varies, but the type of nutrition doesn't vary. In none of these cases are we talking about single food items. Instead, it's helpful to focus on broad dietary patterns, and specifically a whole food plant-based diet.